welcome to this afternoon's Facebook question and answer session relating to vaccination. Apologies for the delay this afternoon. We've been having some difficulties in getting one of our speakers with us, who hopefully will join us throughout the afternoon. Very delighted to be able to have Dr Charlotte Forsyth with us from Great Western Hospital, and also one of my team, public health consultant Penny Marno. So thank you very much both for joining us this afternoon. We're just waiting to see whether Jill May from the NHS is also able to join us to answer some of your questions. In the meantime, we'll go through the questions that we have, and hopefully if Jill's able to join us later in the update, then we will be able to address some of those questions for you as well. Before we get started, I know that normally I provide an update around the COVID situation in Swindon. We won't do that today because we're exclusively focusing on vaccination, but I just did want to highlight that yesterday the government did announce the additional numbers of individuals that will be added to the clinically extremely vulnerable list. So for Swindon, that's an additional 4,000 people that will be added to that list. The government will write to those individuals directly, and we will follow up with a letter on additional support that is available to you should you require it during your shielding time. That may also have an impact on you in regard to accessing vaccination, and again, further information regarding that will follow. Okay, without stalling any further, let's get into the questions then. So the first question is for you, Charlotte. Good evening and welcome. If you can just explain to us what the current offer is in regard to vaccination appointments in Swindon.
Thank you, Steve. So currently across Swindon, the vaccination programme is open to anyone over the age of 80, those over the age of 70, healthcare workers, including NHS staff and care home staff. And then in the last few days, we have started offering appointments to those who are patients who are over 65, and also those who are clinically vulnerable. So anyone who's counted as clinically vulnerable over the age of 16 will also now be started to be invited in.
Fantastic. Thank you, Charlotte. Penny, coming across to you now. How effective are the vaccines?
Okay, so vaccines work by safely delivering a type of antigen which produces an immune response. And the idea of that is so that the body can recognise if a virus comes back naturally, and then it knows how to fight it. Both the vaccines that we've got currently for COVID do this effectively, and we know they're effective because they've been tested extensively through a range of studies across the world. And in the UK, they've been formally approved by the Medicines and Healthcare Products Regulatory Agency in terms of their safety, their effectiveness and their quality. Both the vaccines are given as 2 doses. So the first dose gives good protection, which builds up over that kind of initial 3-week period. And then the second dose gives longer lasting protection. And we know that the research tells us that the benefits of both the vaccines are that people are likely to have less severe symptoms from COVID, and hopefully ultimately prevent hospital admission and death. And we know that there are some further studies to really understand the kind of transmission properties and whether vaccines protect against that. But they are effective in terms of that reducing severity. And there's been a number of studies that have kind of tried to quantify that through percentages. So we know, for example, that the Pfizer vaccine after the first dose is around 90% effective in terms of the benefits, and AstraZeneca sort of 70 to 80% effective. And again, that comes through trials and research.
Thanks, Penny. So whilst we're talking about how effective the vaccine is, can you just explain to us, Charlotte, how safe are the vaccines, and are there any side effects related to them?
Thank you, Steve. So yes, so as Penny has said, all of the medicines in the UK are managed from the Medicines and Healthcare Regulatory Agency. And so they have been the ones that have been really checking at sort of every stage of development of these vaccines. So they have been linking in with the trials that have been going on, and have carried on monitoring this once they have been authorised for use. So in terms of safety, then I can reassure you that the medicines have gone through all of the right checks and processes and are safe to use. And again, the NHS wouldn't be advocating and using any medicines that we had concerns about and had questions about their safety. In terms of side effects, certainly we've been vaccinating quite a number of people now at Great Western, and again it sort of backs up the data that has come out of the trials. Is the side effects are the same that happen with a lot of vaccines when you go and have your flu vaccine, or going on holiday and having to have any immunisations for that. So the common ones are a sore arm where the vaccine has been administered. Some people are developing a mild fever and sort of mild symptoms as if they were having a very light dose of COVID, which is normal because that's the body reacting to the vaccine and having that immune response to it. So in a way, it's a good sign to have some of those side effects, because that's then that you are responding to it. They are normally very short limiting, so sort of 24 hours, maybe up to 48 hours, where the symptoms are there, and resolve well with just taking some simple paracetamol to help with the symptoms. So those are the commonest side effects that we're noticing.
Fantastic. Thank you, Charlotte. So we've talked about efficacy, we've talked about how safe the vaccines are and any potential side effects. One of the concerns we hear a lot about is concerns from certain communities regarding the potential that these vaccines may contain animal products such as pork or eggs. Penny, can you just update us in regard to that, please?
Yes. So yes, as you say, we are aware that there are a number of concerns circulating about what might be in the vaccine. It's very clear from the ingredients and the published information that neither of the vaccines that we use contain any animal products. They don't contain eggs, and they have been recognised as therefore being okay for people who are maybe vegetarian to take, so we can offer that reassurance from the vaccines. The government has also published what's in the vaccine, so if people are interested, on the gov.uk website, which is the main kind of government information source, there is a full list of what's in each one, so people can have a look and reassure themselves.
Fantastic. And a question on everybody's lips, Penny, is, does the vaccine contain a tracking device? No, is the short answer. So vaccines generally only contain ingredients that make them effective against the virus. And the process, as Charlotte mentioned, the process of approval that a vaccine goes through by independent bodies, so it's not a government derived vaccine where people might be suspicious. These are independent science and medical bodies that approve the vaccine, and no, there is no microchip or tracker within it. And actually, if people did want to track, there would be easier ways, such as our mobile phones, to kind of track where people are. You just don't need, you wouldn't need to put it in the vaccine. I suppose one thing I would like to mention is that in terms of information around the vaccine, when people book an appointment, for example, then they might be asked sort of their name, things like that you would normally do if you were booking a GP appointment. What you won't be asked for is any sort of financial information, any payment, your card details, anything like that. This is a free vaccine. It's free on the NHS, and anything that asks for that sort of information, it's likely to be a scam. The NHS just will not ask for that information. So no microchip, and just
you won't be asked for any kind of financial or strange information. This is a legitimate process.
Thanks, Penny. Before I come back to Charlotte then, are any of the vaccines better than each other?
No, they're both effective, safe, and have passed those quality standards. So, you know, either one will be beneficial and effective. And generally, people aren't given a choice. You just get the one because they both give a real benefit, and the evidence supports the use of the vaccines that we have in use at the moment. And it depends really on where people are vaccinated and the availability of vaccine in terms of which one you get. They do work slightly differently, although that principle of generating an immune response is the same. And so there are differences in terms of storage that people might have heard of. So the Pfizer one needs to be stored at a very, very cold temperature, just because of the way it was developed, whereas the AstraZeneca one, it doesn't have that constraint to it. But they both are equally as effective. And in Swindon, you know, if you go to STEAM, for example, for your vaccination, then you may get either vaccine off.
Fantastic, thanks, Penny. Charlotte, some slightly more clinical questions for you. So the first one is around, can pregnant women still have the vaccine?
Okay, I'll answer that one first. So the problem, although we've talked about the safety of these vaccines and the fact that there is a huge amount of data to say they are very safe, the problem that we have is that they are new, and so there just isn't a huge amount of data that we have around the safety of them if you are pregnant. And so on the whole, you know, they're recommended for everyone, but there is caution on any woman who may be pregnant, who is breastfeeding, or who is planning on getting pregnant, and there we would caution whether or not you know, it is right for those women to have the vaccine. There are obviously some patients who will have underlying medical problems, and they may be clinically extremely vulnerable. And certainly I have quite a lot of conversations with my obstetric colleagues. So they are well primed around having those conversations with a patient, with a woman who's pregnant, around the risk and the benefit if they have got underlying medical conditions around having the vaccine, where, you know, and balancing that up. So it's not a definite no, but it's not something that at the moment we're recommending unless there's a really good reason for a woman to have it.
Thank you, Charlotte. And just to be very clear on whether the vaccine affects fertility or not?
So again, there is no suggestion that if you've had the vaccine that will affect your fertility at all. So there's no concerns there around that.
Fantastic. Okay, so the next question is, if you've already had COVID, do you still need to have the COVID jab, or are you just automatically immune?
No, absolutely, you should still be having the COVID vaccine. There's quite a lot of studies going on at the moment around looking at sort of patients' immune response once they've had COVID. And one of the things we do know is that to begin with, your immunity might be quite good if you've had COVID, but it then does drop off. Again, it's a new illness, so we don't have lots of information about it, so we don't know exactly when it's going to drop off or who it's going to drop off on. And therefore, the safest thing is for everyone to be having who's eligible to be having the vaccine, whether or not you think you've had COVID or know you've had COVID. So even if you've had it, you will still be offered the vaccine and should definitely take it up.
Fantastic. Thanks for that clarity, Charlotte. Much appreciated. So Penny, one of the questions that we've asked is around, or have been asked, is around future strains of the COVID and whether people should possibly wait for newer vaccines later on in the year.
Right, so it's really important that people take up the opportunity to have the vaccine as soon as they're offered it. And as Charlotte mentioned at the beginning, people are offered it in a specific order that the Joint Committee for Immunisation and Vaccination is set out. And that order reflects the risk of serious illness and mortality or death for those people. So they're prioritised because risk is high for them. So in terms of the strains, the concerns about the new variants, so viruses do mutate, we know that, and we are seeing different variants of COVID in different parts of the world, and some within the UK. But in a similar way to the flu vaccine, vaccines can be updated to reflect those changes in the variant. One of the things we're really trying to do is to learn as much as possible about these different variants, what they mean in the transmission, what the risk to health is, and to use that information so that vaccines can be adapted. What we also know, I suppose, just to kind of have a plug for it, is that some of those things we've been talking about throughout the whole pandemic, so social distancing, hand hygiene, wearing a face covering, protects you against all variants, or reduces risk against all variants. So they're still important. But in terms of the vaccine, yes, it is likely people will need booster injections like you do with the flu vaccine, where you get a kind of a new one each winter, and that vaccine is adapted to take into account those different strains based on the best scientific knowledge we have. So yes, take this current vaccine. It will protect you as best as possible against what we know at the moment. But as we get more and more knowledge, we can adapt it over the coming years. So people do get additional benefit that is that fits with our best knowledge about the virus and what's happening.
Fantastic, thanks, Penny. And I think you've kind of highlighted the key thing is that we are still learning and growing at the same time as building our understanding around COVID. We've not officially really had it over a year in Swindon yet. We never had our first case until March 2020. So we are still learning and growing as the rest of the medical and the science community as well. So the next question for you, Penny, is if you've already had your COVID vaccine, do you still need to keep wearing a mask? Do you still need to maintain social distancing? And do you still need to be washing your hands?
Absolutely, yes, you do. So obviously the vaccine is beneficial, but we know there is no single intervention that's perfect against COVID-19. And so although the vaccine and being vaccinated will reduce your risk of getting ill with COVID and they're passing it on, do need other interventions in place. So at an individual level, then yes, it's wearing a mask, maintaining social distancing, making sure you wash your hands frequently, keeping good ventilation, and that will work alongside those kind of national initiatives around testing, contact tracing, self-isolating. So if people do have symptoms, they need to get tested, they need to self-isolate, and all those are still just as important as well as having that vaccine. So it is really a kind of a combination of approach that people need to keep taking, and that's our kind of way out and our best way forward.
Fantastic, thanks, Penny. And I think that's one of the key messages is we need to remember that not all vaccines for multiple diseases all behave in the same way, and we're still trying to understand the impact that these vaccines may have on transmission. The key focus of the vaccine at the moment is very much about having less severe versions of COVID for those people that catch it and preventing those excess deaths. So again, very much important that just because you had the vaccine doesn't doesn't mean that you can't go on to spread COVID. So continue to follow those messages is really key. Right, Charlotte, the next few are for you. So the first question is Great Western Hospital confident it can deliver all the vaccines required to the residents in and around Swindon within the timescales set?
So the short answer is yes. Yes, we are. So in a way, Swindon, we're very lucky. We were one of the first 50 hospitals in the country to go live with the vaccine, and part of what that did was it meant that we got an ultra low temperature freezer. So as has already been explained, the Pfizer vaccine has to be kept really cold, down at -70, and we in the hospital have the ability to store the vaccine, and therefore we know where our supply is coming from, and we're able to commit to our vaccination programme. We are also working incredibly closely with our colleagues across Wiltshire and Baines to ensure that, so I know this is a Swindon call, but just to give you that reassurance that we're also working closely with our colleagues and ensuring that all of the vaccination hubs are also able to get the vaccine and deliver their vaccination requirements. And so that's the same with us in Swindon. We're working with our PCN colleagues who are vaccinating in Steam to ensure that they are also getting the vaccines that they need in order to be able to roll out this vaccine programme. And I think it's a real countenance to how hard everyone is working, and we've got some amazing staff and volunteers who are helping us at all times of the day, of the week, to keep rolling this out and keep delivering it. So I'd just like to say a huge thank you to all of the staff, both in our PCN hubs and in our hospital hub, for all that they are doing, being able to deliver these vaccines.
No, absolutely, completely echo that, Charlotte. It has been a mammoth task to be able to deliver the vaccine programme. From a Swindon perspective, as some people will know, we didn't start vaccinating until the middle of December, which was along with other people. And as you've mentioned, we were one of the first areas to go live. And since then, across Swindon, Bath, North East Somerset and Wiltshire, we've managed to vaccinate over 230,000 people. So it just goes to show you the sheer amount of effort from the science to the developing the vaccine to the safety checks required through to delivery in less than a year has been monumental. Yes, a huge thank you to everybody involved in the delivery, but also to those residents as well that have been invited and have come along for their vaccine as well. So on that note, Charlotte, do I need to have my second dose, or is one dose enough?
No, two doses are needed at the moment. So that is so you have one dose obviously when you start off, and then in Swindon we will be calling people back their second dose at 10 weeks from their first dose. And it is, again, it's really important, as Penny has said. So the first vaccine gives you good reaction, it's got good effect, but that second dose will just top you up and give you even more effective cover. So it is really important when you get your appointment for your second dose that you turn up and have your second dose as well.
Fantastic. So this week, Charlotte, we know that we're now expanding to further cohorts. So this may address this question, but somebody's written in to ask that they have diabetes. So when will they be offered their vaccine? So that will now so if you've got diabetes, you will fit within the clinically vulnerable group who are in the cohort 6, and we have just started now with cohorts 5 and 6, so the patients over 65 and then the clinically vulnerable, and so you now should be, you will now get your letter and be contacted in order to invite you in to have your vaccine. My ask is those that you just wait until we've called you, or we've sent you a letter, rather than calling into your GP practice. Both of these groups, the over 65s and the clinically vulnerable, are big groups. There's a lot of patients in these two groups that we're going to be working our way through, and so it's just around
for some maybe being a little bit patient, we will get to you, but it may just take us a little while just to work through. So open your post if it looks like an official letter from the NHS, because it might be your letter inviting you to book your vaccine. But certainly wait until we contact you rather than contacting your GP or the hospital.
Thank you, Charlotte. That's very sage advice. And also to add on to that is just to encourage people not to just turn up at the hospital or at STEAM. Vaccination is booking only, so you will be turned away, and what we don't want to do is disappoint you. So it's an ambitious programme. The plan is that we will see the majority of the population be vaccinated as we head towards the autumn. So I think, yeah, sage word, Charlotte, is to be patient. When you're called, make sure that you take that opportunity to book. Okay. Charlotte, the next one for you is, if I develop symptoms within 48 hours of having the vaccine, should I get a COVID test, and should I be telling my household to self-isolate?
Okay, so as I said earlier on, the vaccines do have a side effect, and one of those side effects is that you may develop a temperature and feel a little bit unwell with it. And so it's quite difficult to know whether or not it's this, if you do become unwell after your vaccine, whether or not it's the side effect or whether or not it could be something else. My advice would be, if there's anyone who feels unwell after the vaccine and develops a fever, develops those classic symptoms of COVID, and you're not sure what to do, then contact NHS 111, who will be able to advise you as to the best thing that you should do, and whether that is to be tested and self-isolate.
Fantastic. Thank you, Charlotte. And then we're coming close to the end now, and hopefully we can address some questions that may have gone towards Jill as well. Penny, could the success of the vaccine programme in local areas affect local restrictions? For example, when children return to school, how many people we can see and what shops and restaurants open?
I think this is when these things is probably at the forefront of a lot of people's minds in terms of restriction lifting. So the government considers lots of different factors in terms of when it makes decisions around restrictions. And one of the key things it's looking at is the number of cases, the number of hospital admissions, and the number of deaths that we're seeing from COVID. And all of these are potentially impacted by the strategy that's in place to fight the pandemic. So the kind of key components of that, as we've mentioned, are the testing, if symptomatic, contact tracing, so people can isolate, and of course the vaccination. So the more people we can get vaccinated, that then hopefully will begin to reduce, particularly, as we've said, the severity that people might get COVID with, because we know the vaccine is effective at reducing that severity and reducing the risk of mortality. So the more people who take up the offer of the vaccine when it's their turn, the more people who are protected against that severe illness, the reduced numbers, hopefully, of those that need hospitalisation or get a really kind of severe or serious outcome. So that will reduce pressure on the NHS, and we know that in terms of reducing restrictions, that's a big driver. And hopefully it also means that community infections may fall somewhat. So all those things together feed into that balance of whether to reduce and when to reduce restrictions. So I think the crucial message is that we'll play our part in contributing to that kind of overall fight by having the vaccination, by obeying restrictions when they're in place, and hopefully we can kind of come out of this in a safe, planned, measured way, based on all those things we're doing coming together.
Fantastic, thanks Penny. So we've come to the end of the main questions for Penny and for Charlotte. I'm just looking at the list of questions that went towards Jill, and what I've tried to do is weave in some of those answers as we've been having the discussion this afternoon. So I think a lot of the questions we were going to ask Jill, we've managed to address. We've talked about what uptake has been like here in Swindon, so we know that over 93% of the eligible population in those cohorts 1 to 3, so the 70s and above, had really effective uptake, which is really important to hear. And as we've mentioned, across Swindon, Wiltshire and Bath and North East Somerset, which is our health and social care system, we've done around 230,000 first doses of vaccine. So it just goes to show what a mammoth task that has been. I'm just looking at some of the other questions. So at the moment, Charlotte, would you like to come in?
So the only thing I was just going to add on to that one is if you've fallen into one of those cohorts and you previously haven't, you weren't sure whether or not to take up the vaccine, or you had concerns but have now decided to have the vaccine, still phone up the contact of where you were invited to have the vaccine. So it's not too late to have the vaccine if you have changed your mind.
Fantastic, thank you. And that's well put, Charlotte. And that's another reason why we were having this this Facebook question and answer session this evening. It's very much to address any of the questions or concerns people might be having when thinking about having the vaccination. So really important that if you felt that you've reactively said no, but through hearing further information that you now want to say yes, then that opportunity is available to you. The key thing from this discussion this evening has very much been trying to give you some further information so that it allows you to make an informed choice as to whether the vaccine is right for you. We know that the vaccine, along with our testing strategies and along with the hands, face, space, ventilate messaging, are all tools that we can use to prevent the spread of COVID. And we are seeing the case rates in Swindon coming down. But the continuation of doing these things is still really, really important. So if you have got that opportunity to take up your vaccine, then make sure you do so. We're doing a lot of work, and we've got a lot of work in the planning to engage with communities across Swindon that are less likely to participate in vaccine programmes, to understand the insight as to why. And some of those questions I think we've addressed this evening, but I think there's more work that we can be doing at a more local level to encourage people to be taking up the vaccine. So I think, Charlotte, I think probably the last question that I'll ask you, which would have gone to Jill, which was around the rolling out of the second vaccine. So I know some people have started to already have their second dose, but when will we see that more in larger scale? Do you know?
So that is coming. I'm now trying to do the maths quickly. I think it's either the last week in February, the beginning of March is when we get to the 10 weeks of when we started doing the initial vaccines. And it's terrible. I should be able to do better maths quicker. But it will be so it's coming up imminently. And again, I just want to reassure people that even when we start doing the second vaccines, our plan is to carry on doing the first vaccines as well. So obviously it's going to be busy for us because we'll be doing second vaccines and first vaccines. But we do know that we've still got a lot of the population, particularly now that we've moved into the cohorts 5 and 6. And moving on sort of down through the groups, there's still a lot of people who need to have their first vaccine. So it's really important to keep targeting them, but we will also be starting to do the second vaccine. So people will be notified of when their second dose when the second dose of their vaccine will be given. And we're definitely making plans for how we're going to be able to roll out both first and second at the same time.
Thank you, Charlotte. Apologies for putting you on the spot there. Originally that was a question directed at Jill, and she probably already did the math. So thank you for being able to answer that question. And again, I think just really highlighting the key thing is that we're not taking our feet off the pedals with this one. So very much still trying to encourage those cohorts that have already been eligible, if they haven't taken up the vaccine, to take up the vaccine, but we'll also then be working in parallel. So still issuing first doses whilst then starting to deliver second dose as well. So again, the work doesn't stop for anyone at the moment, but again, really important that we continue to do so. Okay, that is all the questions, but I thought I would just give you both an opportunity to have any final closing remarks. So Penny, shall I come to you first?
Thank you. No, thank you very much for the opportunity to talk to people today. I suppose the one thing I would finish with is just to say that I hope it's been useful in terms of getting that further information. And if people do have questions, there are some really good information sources. So the NHS has a section about the vaccine and answers some questions in quite an accessible way. The clinical commissioning group also have a frequently asked questions section on their website. So if people want to look at those, again, it might answer questions. And I suppose one ask is that we know a lot of the feedback we get from the community is that what makes a difference to them is knowing somebody who's had the vaccine and can be a bit of an advocate for it. So if people have had it, then you know, that's fantastic. That's great in terms of kind of your role, but also if you're able to allay fears of family members or friends, or kind of just share your experience, that can be really powerful too, and have real benefit. So thank you very much.
Wonderful, thanks Penny. I think there's a real key message there about spreading the word of vaccination but not spreading the infection. So I think that's how I've summarised your final words there. Charlotte, have you got any final words you would like to share with our viewers this evening?
So the only thing that again, one of the things that I have picked up and I have heard from a number of people, particularly those who may be clinically vulnerable and may be concerned and not going, haven't been to places with large numbers of people, was just around the safety of the vaccination sites, and that everyone's put in a huge amount of work to walk through to ensure that that everything is optimised as possible. We know we've got large numbers of people going through, certainly through STEAM and the hospital hub, and we have taken every precaution we can to ensure that they are safe from an infection control perspective. So they are safe environments for people to go to if people are concerned about going to somewhere where there are lots of people. I know vaccines are maybe not everyone's favourite activity, but we have tried to make it as safe and as pleasant. And my other thing I would just say as well is around the staff now in the vaccination centres, is they are incredibly experienced. We've been doing this for nearly 2 months now, and actually the staff are really experienced. So if you're really not quite sure and think you may want to speak to someone, then my suggestion would be to book your appointment if you've been invited to come for a vaccine, and then to have those conversations with the staff on the day, because they will be able to answer any of your questions or concerns. And they really do understand the concerns that people are having. Lots of people have asked lots of questions, so you won't be the first one. But my recommendation would be to have it.
Fantastic, thanks Charlotte. And I know through all the staff involved in the delivery of the programme, be that the clinical staff that are doing the vaccinating, or even the volunteers that are involved in helping people to get to where they need to go, a very warm welcome awaits you. So do not feel anxious or nervous about doing this. This is daily bread and butter to our NHS services to be able to provide this to you. So I think thank you very much, Penny Marno, for stepping in this evening and talking about public health, which gives me a little bit of a rest. So thank you very much. And thank you very much, Dr Charlotte Forsyth from Great Western Hospital. Really appreciate your involvement this evening as well. We've talked a lot about vaccination, and we hope that some of the information that we've given you tonight has been able to give you a bit more of a bit more information so you can make an informed decision as to whether you wish to pursue your vaccination or not. And hopefully we've done our best to persuade you that vaccination is absolutely the way forward, and that vaccination awaits you in Swindon as well. So I'm very happy that we bring this this session to a close now. So remember, protect yourselves is protecting each other, and just remember that Swindon, it's up to all of us. So thank you very much. Have a great evening. Take care. Bye-bye.